This afternoon, I'm joined by Dr. Ramon Ylanan. He is our sports medicine specialist at Arkansas Children's Northwest. We recently formed a partnership bringing sports medicine coverage to local high school students at Arkansas Children's Northwest in Springdale. So this is a new program, a new clinic in Northwest Arkansas, but it's taking care of student athletes as they are playing in Northwest Arkansas. So this is a new program. We're excited to hear more about it. So Dr. Ylanan, welcome to Remote Facebook Live.
Rebecca, thank you for having me on.
So first, before we dive into the program and what is happening at the clinic, if you could just tell us a little bit about yourself and the training that you got to get you where you are today.
Well, I'm Ramon Ylanan. I'm a primary care sports medicine specialist with UAMS here in Northwest Arkansas with the Department of Orthopedics. I have been here almost 9 years practicing primary care sports medicine in Northwest Arkansas, previously with a different group, but now with UAMS over the last year. My specialty, primary care sports medicine, is a fellowship after your primary residency, in my case, family medicine. So I did my residency in family medicine at the University of Missouri, and then did my sports medicine fellowship in Birmingham under Dr. Andrews and the other gentleman there who helped train me. Then initially took care of South Carolina for about 4 years before coming over here almost 9 years ago.
So what exactly does a normal day look like for you? What does a sports medicine specialist do?
That's the best part about my day. It's never the same. I've taken care of in the same day kids as young as 14 months old with little fractures to 103-year-olds with knee arthritis and everything in between. So my ability and the things that I do in sports medicine and primary care sports medicine is the gambit of all the non-operative options for musculoskeletal injuries, musculoskeletal care, from the pediatric all the way to the senior.
And I think that approach is important, the non-invasive treatment approach. Most parents, I know if my child got injured in playing a sport, I would think that surgery was always needed and maybe that was the only option. Tell us about the non-invasive treatment approach.
If you actually look at majority of sports medicine injuries, they're not surgical. Most sports medicine injuries are actually the non-surgical type, whether it's ankle sprains, shoulder dislocations, rotator cuff tendon issues that we see on a regular basis. And it also depends on which sport is going on and what the athlete does for that sport as to what's most common for them. But majority of sports medicine injuries can be managed non-operatively, whether it's with physical therapy, rehab with their athletic trainers at their school, or with a physical therapist. There are braces that we can use to help bridge the gaps between injury and back to normal play, use of medications, anti-inflammatories and such. So there's a wide range of options for active folks, whether they're the recreational athlete, the high school athlete, the collegiate athlete, the weekend warrior, that allows us with our tools to get people back doing the things they like to do without operative intervention.
Excellent. And I know you said every day is different, but is there some common injuries that you see for and care for in children?
I'd say the two most common things I'd see in kids are ankle issues. The classic ankle sprain is something that we see quite a bit. And the hard part for a lot of parents, especially with young kiddos, is trying to figure out, is it an ankle sprain or is it an ankle fracture? Because a lot of times the pain is so intense immediately that it's hard to tell when they're playing basketball, when they're playing football. And so a lot of times they'll come in and we'll x-ray them and we'll try to determine fracture versus sprain. It depends on their sport too, for like here with soccer players or basketball players, lower extremity issues outside of the ankle, the knee is a very common one as well. They wrap themselves up with another player or they get collision. Right now, football is kind of in the playoffs, so there's collision injuries that happen with knee injuries also. So the two most common things we'd see are probably the foot and ankle injuries and then the knee, followed by the shoulder.
Topic that usually comes up is concussions. So if a coach or a parent suspects a concussion, what should they do?
Well, the first thing that you should do is the moment you suspect a concussion is remove an athlete from play. If there's any concern, we always say in our field, when in doubt, sit them out. If there's any concern that the athlete, and whether it's football, soccer, basketball, cheer, uh, and a concussion is potential, then the best thing to do is remove that athlete from the field of play and then have them monitored, whether it's by their athletic trainer and evaluated that way or with a specialist to determine do they or do they not have a concussion? And if they do, what's the safest way to allow them to return to play so that when they do get back on the field, we're not worried about long-term issues that happen with concussions.
Our sports medicine program here at Arkansas Children's has a really good relationship with our athletic trainers. Tell us how you work with that partnership with athletic trainers at your program.
Well, if you really look at it, athletic trainers are the foundation for everything that is sports medicine outside of a clinic. They are the extension and the ability for us to take care of athletes when they're not in our clinic. And really, the first line of defense of thing for any athlete after an injury is their athletic trainer. So we're fortunate enough to work with athletic trainers throughout Northwest Arkansas and with our relationship with Arkansas Children's to provide care to student athletes at their schools, which happens at events for their sport, whether it's rehab and that at the training room for a musculoskeletal issue or a concussion rehab protocol, for example. They can also get them squared away with braces and certain ways that they can tape an injury to allow that athlete to return to play. So if you really look at it, the athletic trainer is the cornerstone to good athlete care.
So the benefit of having an athletic trainer is that they're at the school, and so care can start right away. Is that what you're saying?
Correct. Yes. For schools that have athletic trainers, it is a huge asset for those kids and those parents to know that there's somebody there that is focused on their health and safety and well-being of their kiddos and their student athletes. The downside, just like in a lot of states, there's just not enough funding for athletic trainers to be at every school. So athletic trainers do get pulled in a lot of different directions. Some schools are fortunate to have an athletic trainer. Some are fortunate to have two or three. But yeah, for the health and safety and well-being of athletes, the more they're around athletic trainers, the more athletic trainers are there for them, the better their care is in the long run.
New partnership bringing sports medicine coverage to Arkansas Children's Northwest. So what does that mean for student athletes who are playing sports in Northwest Arkansas?
It allows all the kids in Northwest Arkansas to have an avenue for care and a collaborative care model between children's UAMS and the athletic training world to provide a level of care that really has been fragmented potentially in the past, but now really unified. And I think as this collaboration and this relationship grows, we'll be able to provide more and more care to not only the schools that have athletic trainers, but also avenues for parents at schools where they may not have an athletic trainer to know that, hey, at Children's, I can go get seen, I can get taken care of there. And there are relationships between specialists in the musculoskeletal, both the non-operative and the operative world, to help athletes get back to play.
Awesome. Well, thank you for championing children at Arkansas Children's Northwest, especially student athletes. We hope your student athletes stay safe on the field and in play. But if they do need an appointment, they can call Arkansas Children's Northwest at 479-725-6995. Dr. Ylanan, thank you for your time today. And thank you for championing children at Arkansas Children's Northwest.
Rebecca, thank you for having me on, and I appreciate it. Thank you.